Hello, YouTube family. It is Dr. Tanya Lambert here. I'm a women's health educator and medical doctor. My focus is helping women with fibroids to get the information they need to assist them in making practical health decisions to help you on your health and wellness journey to healing naturally from fibroids. In this episode, I'm going to be sharing with you a test that can help you get to the bottom of your hormone imbalance that may be contributing to fibroid growth. And the name of that test is the Dutch test. Now, before I get into my content, I want to share with you my disclaimer, and that is the content that I present in any of my videos should not be used to diagnose, treat, or cure any disease. Continue to speak with your licensed healthcare provider for all of your healthcare needs. The information that I provide is strictly educational and it should be used for informational purposes. Okay, let's get into this exciting topic. Some of you have probably already heard that fibroid growth is due to excess estrogen or estrogen dominance. Many times when ladies go to their conventional medical practitioner and they get a blood test for their hormones, their estrogen levels may actually come back elevated or even normal. In the case where it's normal, you may wonder, well, exactly what is causing the fibroids? Well, getting a Dutch test will help you understand what is going on with your hormones. The Dutch test measures a variety of hormones and even the metabolites or the breakdown products of those hormones. So essentially, it helps you to figure out how your body is breaking down hormones like estrogen. So the word Dutch stands for Dried Urine Test for Comprehensive Hormones. It is a very simple test for the client or patient to perform. You would typically order it from your naturopath or your functional medical physician, and you would do the test at home. It takes about 24 hours to complete, and it is very simple to do. The reason why this is so important for women with fibroids to have is because there are different types of estrogen. Many times when you go to your conventional medical doctor, they measure one type of estrogen called estradiol or E2, which I will talk about in more detail in an upcoming slide. But when you get the Dutch test, it actually helps you understand exactly what is going on with various hormones like estrogen, progesterone, testosterone, cortisol, and even melatonin. And it also tells you how your body is breaking down some of these hormones as well. Once you have that information, you can then better select foods and supplements that can help you to heal along with your healthcare provider. Now, it's very important that you understand that the Dutch test is not a diagnostic test. It will not diagnose any medical disease, and also it will not test for thyroid hormones. You will have to order a separate test for that. I spoke about the complete thyroid panel in my previous video. Now, I want to review what exactly is estrogen. Now, estrogen is the hormone that keeps us ladies feminine. We have more estrogen in our bodies than men do. And there are three main types of estrogen. There is the estradiol, also known as E2. This is the predominant form of estrogen that is produced by the ovaries in women who are menstruating. Estrone, or E1, is the estrogen that is produced by the adrenal glands in women who are transitioning to menopause and then in menopause. And estriol, or E3, which is produced by the placenta in women who are pregnant. Now, estrogen is a very valuable hormone, ladies. It helps to keep our brain functioning properly, helps us stay sharp and focused, helps us improve our memory, and also helps us to maintain our feminine features. And for girls that are undergoing puberty, it helps with breast growth and development and the formation of your womanly curves. Estrogen dominance has been explained as one of the root causes of uterine fibroids. But the issue is not necessarily the estrogen, but how your body's breaking it down and how it is eliminating the excess estrogen in your body. I'm now going to share with you a lab report from a client of mine that has estrogen dominance due to hypothyroidism and chronic constipation. Now, the purpose of me showing this result with you is to give you an idea of what you may possibly see if you are to get a Dutch test. So here you are looking at an example of a Dutch test in a woman who is estrogen dominant. This is just one sample page of the full complete report. On this sample page, we see 3 categories of sex hormones, including androgens, in which the testosterone is measured. You will see progesterone, in which the progesterone, or in particular, the breakdown products of the progesterone is measured. And you will also see the estrogen, the 3 types of estrogen, including E1, E2, and E3, and the breakdown products of that estrogen in the liver. Now let's take a close-up of the estrogen of this particular client who is estrogen dominant. When you are looking at your Dutch report, the values of each hormone will be present in a white circle surrounded by a dial. The green portion will show you what the normal limits are, with the star at the far left being the lower limit and the star at the far right being the upper limit. As you can see, the estrogen levels of this client are at the higher end or the higher limit of normal. Now, when estrogen is broken down in the liver, it can go down 3 pathways. The most important path that is considered in women with fibroids is the CYP3A4 pathway. So this is the blue arrow. This indicates that estrogen is broken down by an enzyme called CYP3A4 to form a metabolite or a breakdown product of estrogen called 16-hydroxyestrone. There are 2 additional pathways here that are not as estrogenic. However, the CYP3A4 pathway is the most estrogenic. And in my client here, 16-hydroxy-E1 is elevated. It is well beyond the higher limit of 2.60. So she's almost double. And the issue with having an elevated 60-hydroxy-E1 is that when this breakdown product of estrogen is elevated, it contributes to fibroid growth, heavy menses, and even breast tenderness. So getting a Dutch test is very important in helping you to see where exactly your hormones are imbalanced. Because when you know where your hormones are imbalanced, you can then focus on foods and supplements that can help you to balance out your hormones or improve metabolic pathways that can help you to eliminate toxic levels of certain hormones or even balance your hormones. Now, I want to share with you foods that you should be eating if you have estrogen dominance to help you to balance your estrogen so that you can have normal estrogen levels. First and foremost, to help you to remove 16-hydroxy-E1 from the body, you want to start with a low sugar diet. You want to eliminate cane sugar, especially white sugar, because they are toxic to the body. They promote inflammation, contribute to insulin resistance and obesity, all of which depletes the progesterone in your body and increases estrogen. Also, refined sugar depletes your body of vitamin D, an essential hormone that helps to shrink fibroid tumors. It is best to focus on savory foods and some fruits like berries, which I'm going to talk about in an upcoming slide. A supplement that you may consider to help you improve the detox pathways of your liver is DIM, D-I-M, or diindolylmethane. This supplement also helps to remove excess estrogen from the body. You can get it in a supplement form, but you can also get DIM from cruciferous vegetables, including broccoli, kale, Brussels sprouts, broccolini, and radishes. But if you have hypothyroidism, you may want to limit or even omit cruciferous vegetables for a time. The reason for this is because cruciferous vegetables have compounds called goitrogens, and goitrogens can reduce your thyroid functioning. So therefore, consumption of large amounts of cruciferous vegetables can worsen thyroid functioning. If you choose to eat cruciferous vegetables, you may want to steam them and eat them in limited amounts. Ladies, You want to make sure you're getting vegetables from the Apiaceae family. These vegetables are very important in improving the detox pathways of the liver and even removing heavy metals from the body. This includes carrots, cilantro, coriander, celery, celeriac, fennel, and even parsnips. Consider eating herbs like fresh rosemary, ginger, oregano, and basil because they help to reduce inflammation in the body by inhibiting an inflammatory protein called NF-kappa beta. Eat lots of broccoli sprouts. They are rich in sulforaphane and glucoraphanin, which help to improve the detox pathways in the liver to help you balance your estrogen. You can also consider eating grapefruit, which helps to do something similar. However, avoid grapefruit if you're taking statin drugs to help reduce blood cholesterol levels, because eating grapefruit can actually increase the side effects of statin medication. So speak with your doctor and nutritionist before starting any new dietary regimen if you are taking medications. You want to make sure that you're eating lots of grapes and berries, blueberries, raspberries, strawberries. They are rich in an antioxidant called resveratrol. This antioxidant helps to break down fibroid tumors and even break down the extracellular matrix, which forms the capsule that protects the fibroid tumor. So make sure you're getting berries into your diet. And ladies, skip the wine. I know you've probably heard that drinking a glass of wine in the evening is great for your heart health, but even the American Heart Association now admits that drinking wine, even one glass, is not good for your health. In fact, it reduces the detox pathways of your liver by inhibiting the activity of the CYP3A4 enzyme, resulting in elevated estrogen. So what's the point? Eat the grapes. Plus, from a spiritual perspective, it also helps you to maintain a clear mind and connect with God when you focus on a holistic diet with fresh fruits and vegetables and skip the alcohol. Get your B vitamins. B vitamins can be found in beans, bananas, sunflower seeds, avocados, and green leafy vegetables. Why B vitamins? Because B vitamins are very essential to helping your liver to detox unneeded estrogen metabolites. Also, if you are vegetarian and you're not strictly vegan, eggs are a great source of B vitamins as well, and also a complete protein. But anytime you choose to eat animal products, you want to eat them sparingly, and you also want to make sure you know your source of these eggs. Sometimes the ladies I work with are not strictly vegan, and some may do a little bit better with eggs in their diet. So you just want to make sure that you are getting a good source of eggs if you choose to do so. Finally, I want to share with you a few things that you should avoid. It is the summer months and people are starting to barbecue. Stay away from those charred meats, burgers, hot dogs, and I don't even care if it's vegetarian. Why? Because when you are charring food, that produces chemicals called polycyclic aromatic hydrocarbons. And these chemicals contribute to fibroid growth. Limit your exposure to foods that are not grown organically so that you can avoid pesticides because they are also filled with PAHs as well. Stay away from caffeine. Caffeine or coffee is a source of these PAHs. And also, sis, if you are smoking, please get help to quit because when you burn that tar in your lungs, it's going to increase your exposure to those PAHs and contribute to fibroid growth. I want to end this by saying that if you have fibroids, it is so important that you get a Dutch test. This will help you get to the root cause of what's going on with your hormones so that you can take the right steps to help you to heal. A Dutch test can be ordered from your functional medical physician, a naturopathic doctor, and even some chiropractors. I want to end this video by saying that while estrogen dominance is a root cause of fibroids, not all women with fibroids are estrogen dominant. Sometimes they may have elevated or even low cortisol levels. And in my case, I was one of the women that actually had very low cortisol levels and I had normal estrogen. In the next video, I'm going to share with you how the Dutch test can help you understand what is going on with your cortisol levels. And this hormone is so important because, sis, women are in a state of emergency. We have been under a ton of stress, especially with the most recent pandemic and many other issues that are going on in our lives. And so, having a Dutch test can also help you to figure out what else is going on with your hormones, including your cortisol levels. So, I'll be sharing some awesome information about that with you in the next video. If you like this content, give it a thumbs up, share it with your friends, subscribe to the channel, click the notification bell, and I'll see you next time. God bless.